Hello everyone, it is Princess_Minnie4 and welcome back to my channel. In today's video, I'm going to be explaining to you guys how I was in the hospital the other day. If you guys are new here, please make sure you hit that notification bell and hit that subscribe button so you never miss a post. Alright you guys, so I think I'm gonna be looking at my computer so I can Google stuff, you know. But I think it was either Friday, August 15th or Saturday, August 16th, where I started having like chest pain, which I have been having chest pain pretty much off and on. I would say since I was like a teenager. I don't know, maybe that's when my heart disease developed or whatever. I don't really know. But I've kind of had heart disease. I've kind of, sorry, I don't know, I'm burping. I've kind of been having back and forth chest pain, heart palpitations, all of that since like high school. That's the earliest I can remember it. Cause I remember one time I was having like anxiety when I was a senior then. And I remember just my chest was just hurting so bad. And that's just that one circumstance. But, you know, cause obviously, what people don't always realize is that chest pain is not always cardiac. You know, like you can have chest pain, like right now I'm having acid reflux. That's a form of chest pain because this is all your chest, you know. So it's like I have that here, you know, sometimes you have chest pain over here, you know. So it's like, obviously, I don't know, is it always safe then sorry to go to the emergency room when you have chest pain? I would say yeah, because it could be, but it also could not be, you know. So I remember when I like really paid attention to it when I was at work, and I had filmed a day in my life then, and I forget what day that one came out. Was it the 20th? The 20th or the 24th of August. I had uploaded the video of me being at work. I could probably Google it and find it. Where I was at work and I was just having really bad chest pain and all that. And then it was like, you know, something told me to take my blood pressure, because when I first was diagnosed with left ventricular non-compaction cardiomyopathy, my cardiologist put me on lisinopril. And lisinopril is for people with high blood pressure, and it lowers your blood pressure. But my blood pressure is usually like 117/80, 117/75, you know. Like my blood pressure, is it high? Sometimes, yeah. But everybody's blood pressure is high sometimes. Sometimes you're nervous. It's a whole bunch of things. And it's like, whenever I go to the doctors, like sometimes it's high, other times it's not. And he's like, yeah, but when you're here, it's been high. I'm like, are you listening to yourself talk? When I'm here, it's high. You know, some people have like the white cone syndrome when they're at the, you know, the doctor's office, they're nervous. And one thing I think is dumb, at my job, for example, we call back the patients. We'll say, yeah, Princess, and then you call them back. You say, yo, get their temperature, their height, and their weight. Then you bring them into the room and you automatically get their blood pressure. Then it's high, you know. And then what happens is, what I like to do, if it's like a slower day, I'll wait a few minutes and let them get changed and kind of settle down. Then I'll go back and get it again, because if it's still high after they've rested, then it's probably a problem. But sometimes it's just like, you could be cleaning up, you take your blood pressure is high, you could be stressed out, you know. So the doctors are just like, they have it written on my thing that I'm being like checked out for high blood pressure. My blood pressure is not high normally, you know. But that week it was high, and I don't really know why. But yeah, I don't know. It could just be like, so honestly, I just think mine is stress related. Even when it comes to my diet, the way I've been eating, I just think it's all stress related. It's a stressful job. It's a rewarding job, absolutely, but it is still stressful sometimes. We have all these, like I said, if there's a day and you have a provider with sick visits, they schedule sick visits every 15 minutes. So you got a 2, a 2:15, a 2:30, a 2:45, a 3, a 3:15. That's stressful, you know. So it's like, I'm not really worried about my blood pressure. I don't think I have high blood pressure. But that video was called a last minute vlog. It was a frustrating day as a medical assistant. I wrote chest pain and high blood pressure. So I was having the chest pain, and I was like, something just told me to take my blood pressure. It was my lunch break. I had to wait for, you know, y'all just watch that video. So while I was sitting there, I just took my blood pressure. It was like 143/93. It was crazy. Then when I got home, either later on that night or the next day, it was like let's just say 150 something over 100. That's insane. That's a really high blood pressure. So I don't know what was going on. It's just because we're having a stressful day. Maybe I do have blood pressure issues. I don't know, but I don't always, because then I was taking it kind of consistently, and it's been back to normal. 117 over 50, not 50, ain't never that low. 117 over like 80 something, you know. So it's like, and then when I was taking the lisinopril, it was like 92 over 53. Yeah, I was not feeling good, and I was having chest pain then really bad. So that's why I stopped taking the lisinopril. I think I took the lisinopril for 2 weeks, and then it just made my blood sugar too low. My blood sugar, well, that too. It made my blood pressure too low that I was like, I just reached out to him. I said, look, I don't want to take this anymore. I've been having really bad chest pain. I've been feeling really out of it and coughing all night, because that's what it does. And then it's like my blood pressure has been really low. So he said, you don't have to take it anymore. So boom, now we're August 18th, had all that stuff happen. Then yeah, went through the whole entire week with the same thing, chest pain every day, blood pressure reading high, low, in between, all of the time, you know. So then Tuesday the 26th, I had off, and I went to Volkswagen, and my car had her little yearly, you know, oil change, all that. I spent $300. We love it. Not just for the oil change though, there was other stuff. Something was cracked in my windshield wiper, so I said, I'm here, just change it. I don't want to come back, you know. Anyway, ain't it something, y'all? This is the life of being an adult though. So later on that day, because I had started having heart palpitations, which, another thing, I have heart palpitations off and on all the time, and sometimes they're with shortness of breath, sometimes they're not with shortness of breath. I go to the hospital, I go to the emergency room, nothing's wrong with my heart. So I don't know, I just feel like it's also just either it's just something that I go through. And I was Googling it, and I was reading this little article that heart palpitations for the most part are not always like, you know what I'm saying? A lot of times it's just like a whole bunch of things could be going on, and a lot of times it's just the heart's just doing what it does, you know. So that day I started having heart palpitations along with the chest pain, and I was having shortness of breath, and I couldn't really feel like I could get a full breath, which sometimes I don't know, maybe that could be because I'm gaining weight. That could be why, because I feel like still a lot of times nowadays I still don't feel like I can get a full breath in, but I don't know. Because if you ever see me do that, I've been doing that a lot, because I feel like when I talk I run out of breath. I'm like, what's going on? So anyway, I just kind of was like, I'm just gonna go to the emergency room, because it's like, at this point it's been a full entire week of me having the chest pain, and now it's the chest pain alongside with the shortness of breath and the heart palpitation. So I went to the emergency room with me and my grandma, and I drove there, which I know it's like, why'd you drive there? I'm like, I've been working all week, so you know, I've been driving back and forth to work. But yeah, one thing I did notice when I was having the chest pain, that I would press on my chest and it was tender. But it's like, I'm not a cardiologist. I'm like, that's weird. But then I just kind of just went to work. You know, my life is really right now is get up, work, go home, go to sleep. Get up, work, go home, go to sleep. I had days off, I go to appointments, come home, go to sleep. That's my life right now. So it's like, I'm not worried about my health, honestly. I'm just like, whatever. Because at the end of the day, I got to clock in and take care of my patients. My patients come first. So I know that's dumb. You should take care of your health. But I got like 2 hours of sick time, so you know what I'm saying? So I go there, and the lady was being like smart. She was like, you said you've been having chest pain since the 18th. I was like, yeah. She's like, today's the 26th. I'm like, yeah. She's like, you just told me you have heart disease, cardiomyopathy. I said, yeah. She's like, you shouldn't wait for a week. You should come anytime you have chest pain. I'm like, at this point, y'all's gonna have to make me a room. I have chest pain all the time. You know what I'm saying? Like, I'm not trying to be like that, but it's like, I have chest pain all the time. So it's like, good thing my insurance pays for it, because if not, I'd be having to pay out of pocket to go there for nothing. So long story short, nothing happened. Nothing's wrong with me. Yeah, so I got there, and they call you back automatically when you say anything with chest. So then my blood pressure was high. I think the first 3 times they took it, because it takes it every 30 minutes, it was high. Then it got back to normal. The whole time I'm there, the thing is going off like bradycardia. That's just my life. Like, my heart rate is normally like 49 through like 65. That's my heart rate. Everybody's heart rate is different, but I think once you get below 50, that it's considered bradycardia. But that's just my heartbeat, you know. Even my cardiologist has said that to me before, you know. So yeah, so they took some labs. This is my little discharge paper. They took some labs, and they really only took a urine to see if I was pregnant, which I don't have sex. I'm not pregnant. But yeah, they don't believe that. They're like, she's 23, she gotta be shacking up. No, I don't be doing nothing. I'm just here. But yeah, so when the nurse came in and she pressed on my chest and I told her it was tender, she was like, my alarm went off. She was like, yeah, that doesn't seem like a heart attack or any kind of heart issues, but we're still gonna do all the tests. So we went there. Do they tell you what time I was admitted? It was like 7 o'clock. I may insert some pictures. It was like 7 o'clock when I got there, and didn't leave till, I would say, about 10. That's what irritates me. And then I'm leaving and there's nothing wrong. Like, not that I want something to be wrong, but I just don't feel like wasting my time. I was like, it was my day off and I couldn't work out. You know, it was annoying, you know. But it is what it is. I literally came home that day because it was like 10 o'clock. I literally just washed under my underarms. I didn't even brush my teeth or anything because I was just like, I gotta get up in a few hours anyway. So that's how upset, that's how irritated I was about the whole situation. But yeah, they weighed me too. I forget how much I was weighing, probably like 160 something. But so I'm gonna read y'all what it says on here. So they took some lab work. I'm gonna go on that in a second. I don't want this video to be too long. But they told me to follow up with their heart and lung center, but I have to go there September 15th, so I'll just wait till then and I'll just tell her about that. And then they wanted me to also follow up with my primary, which I do have an appointment on the 5th of September, so I'll be following up with her. And then yeah, so they pretty much, they took, like I said, they took blood, did urine, then they took a chest x-ray, and then they gave me this lidocaine patch to see if it helped with the pain, which it did end up helping with the pain. Not all the way, the full time, like every now and then I would still have a chest pain then, and I was still having heart palpitations. And even when they discharged me, they said nothing about the heart palpitations and shortness of breath. So I guess I'll just go, like I said, I'll just go to my cardiologist and tell her about that. But I'm gonna try to get up without showing the, hold on. So this is what they said, hold on, what is that? Costochondritis. I don't know. So it's swelling and irritation or inflammation of the tissue or cartilage that connects your ribs to your breastbone or your sternum. This causes pain in the front of your chest. The pain usually starts gradually and involves more than one rib. Because when I'm like right here, it's so, not right now, but it's still, actually when I get right here, it's still tender. It's tender. And it says the exact cause of this condition is not always known. It results from stress on the cartilage where your ribs attach to your sternum. The cause of this stress could be chest injury or trauma, exercise or activity such as lifting, which I don't do, and I had no chest injury, and severe coughing, which none of that, you know. So we don't know where it came from. So I'm trying to think of what I did on the 15th. Was I working on the 15th of August? Yeah, I was. And I worked a half a day. Maybe when I cleaned up on the 16th, maybe, I don't know. Like, it could have been, that's the thing. It could have been, maybe I was doing something too heavy, I don't know. So it says, what increases the risk? You may be at higher risk if you are female. Be so for real. Are 30 to 40 years old, recently started a new exercise or work activity, have low levels of vitamin D, or have a condition that makes you cough frequently. So pretty much this is just all of this, because the chest x-ray showed nothing. And they had the nerve to say, the lady was like, your blood work came back perfect. And then it shows you they didn't come back perfect. I'll get on that in a second. This is just telling you what you could do. You could either use heat, you could either use ice. Then it says come back right away if you have shortness of breath. Isn't that why I was there for? They literally didn't even talk about that at all, or the heart palpitation. So you have nausea or vomiting. I have nausea every single day. I literally had 2 big nausea spells today and 1 yesterday while I was pulling back a patient, about to throw up on the patient. Yeah, that was amazing. Cough up blood, feel sweaty or lightheaded. I feel lightheaded every day. Like, this is just my life, you know? So it's like, at this point, just admit me to the hospital, have me stay there, because I can never live on the outside, because I have all these symptoms every day. But anyway, but yeah, so those symptoms, the nausea, the lightheaded, the coughing with mucus or coughing up blood, and shortness of breath, it's just, do not wait to see if the symptoms go away. Get help right away. Y'all, call 911 because I gotta go to the hospital. I was nauseous earlier. Like, this is, to me, it's dumb. But anyway, yeah. So pretty much they told me that I can take Tylenol. And yeah, pretty much that's it. And then they give you like all the little, what's it called, education things about it. So now I'm gonna do my lab work. And I highlighted it because I want to go and talk to my primary doctor about it. So they did this thing that says MDW, which is a monocyte distribution width. So that's what that means. So MDW. So my MDW was high. Hold on, let me Google it. I hate Bing. I don't know. I just hate Bing, y'all. So. And my MDW was 21.85, and it's labeled as high. But remember, my lab work was phenomenal. Come on. That's why I think it's funny. So this thing says a value of 21.85 is considered high. An elevated MDW suggests that the size of a patient's monocytes, which is your white blood cell, has a larger than normal variation, which can be an early indicator of a dysregulated immune response to an infection. I feel like 9 times out of 10 when I get blood work, it's always something that I'm running an infection. Like, I feel like, am I just like easily sick? I'm telling you, a lot of times when I get blood work done, like all those little things that like show, like, I think if you have like, I always have like a higher number of white blood cells. It's always that. So it says when you have in between the 21.5 through 22 range are often used in emergency departments to help identify adult patients who are at an increased risk of developing sepsis. So it's like, sepsis is a life-threatening condition which is caused by severe and dysregulated immune response to an infection. So, I mean, if any of y'all are doctors, then y'all can tell me like, oh, that's not good. But anything greater than 20 is considered high, which means that I'm at a decreased risk of having sepsis. But it does say right here, you're at an increased risk of developing sepsis within the first 12 hours of a hospital admission. So maybe it's not a bad thing when I'm not being admitted, but I guess if you're being admitted, that's high. I don't know. So that's the first thing, like I said, but they said that my blood work was perfect. So we have a few things that I highlighted. I don't play about my health, y'all, if y'all can't tell. So they said that my lymph manual was high. So you Google that, that means that they're high after an infection. So mine was 67%. So I just want to see if that's really high or not. So it means you have a higher than normal percentage of a white blood cell, like I said. While this can be temporarily and harmless response to an infection, but it could also mean more serious or an underlying condition. So it says a normal typical lymphocyte levels for an adult is between 20 through 40%. Mine's 67. So that could mean like viral infection, bacterial infection, chronic infection, autoimmune disorders. And then it's like, I don't know what that is. As a person's had their spleen removed. I think I got my spleen. I don't know what I got. Then of course it's like, oh, blood or lymphatic cancer. I'm like, oh, great, great. So yeah. Then my ALT, which ALT is your alanine aminotransferase, which is this is for your liver function, and it detects liver damage or inflammation. So mine was 12, which They say that's in the normal range, but on here it's labeled as low. But this one says between 7 and 56. I don't know. Anyway, but they say that value varies. Then my neutrophils are low. Then my PTT time is high. Like, this is crazy, y'all. But like I said, I had perfect lab work. Let's see, no, 30%. So my neutrophils were 30%, and it's labeled as low, and it is. The normal is between 40 to 60. A low can mean an infection. So I'm wondering if I'm just like fighting off some kind of infection from work, because I mean, other than work, y'all, I don't go anywhere else. So with the PTT, 37.5 seconds is prolonged, and the normal is 25 through 35 seconds. And I think, what does that mean? It says this suggests that your blood may be taking longer than average to clot. So yeah, it's just a lot. Then my BUN and creatinine ratio was 7.5. But yeah, so I ended up being discharged, like I said, around 10 o'clock, and they just said take Tylenol or ibuprofen, which I told them I can't take ibuprofen. So they said take Tylenol or ibuprofen as needed, and get the little lidocaine thingies, patches. So here's what I bought. Actually, yeah, that video will be coming out after this, but I bought these from Walmart. Salonpas pain relieving patches. They're a little bit smaller. They're like literally this size, but I just put it right here and I just leave it on, and it says you can leave them on for 8 hours. So I usually put them on overnight, and usually by the time I wake up they're falling off because I must sleep wild. But so that's what I've been doing. Now with the heart palpitations and the shortness of breath, maybe there will be a part 2 of this video. Now my BUN and creatinine was 7.5, which the normal is between 10 through 20. And they said this is from a low protein diet, malnutrition, liver disease, or overhydration. Yeah, I don't know about that. It's probably my diet though. I'm not a strict vegetarian or a low protein diet, but I know I don't eat enough protein. So yeah. Then it says pregnancy, drinking too much fluid, that could be a problem. Because I drink 64 ounces of water, and I usually have like a tea and a coffee sometimes. So maybe that's that. But other than that, oh yeah, they also did an EKG, and that was normal. So, which I knew that was going to be normal, because whenever all my EKGs I've been having, I was in school, we had EKGs all the time. It was always normal. Then I got my heart MRI, and that's when they found out I had heart disease. So pretty much is the fact that I have heart disease is the fact that I'm gonna be in the hospital a lot, y'all, because it's like you don't know when or if my heart function is going to worsen, since he said in his words it will worsen. It's just a matter of when or how long. So, and he said if I start having chest pain, heart palpitations, shortness of breath, to go to the emergency room. So that's what I did, even though I feel dumb when I leave and it's just something as small as a chest wall injury. But what can I do? So that's my little event that I had on the 26th, y'all. It's a lot. I feel like I said, I definitely feel like it was definitely just stress. Like even if you search up like heart palpitations, they literally, like I looked up when are heart palpitations dangerous, and usually it says if there's chest pain, but then again it says severe crushing or radiates to your arm, jaw, or back, that's when. But I didn't have that. It was just like right here. Then it's shortness of breath, which I do have that. It says difficulty breathing or feeling like you cannot catch your breath. When I'm at church, y'all, I'm not a good singer, but I'm always singing when we're worshiping and stuff. The past few weeks, I had not been able to sing like I used to, like, because I just always have to go, like, I can't breathe like I used to. It's weird, and I went to the emergency room and they just completely didn't say anything about that. Then it says sweating or a rapid or irregular heartbeat, which when I eat, and I feel like lately, I don't know if it's certain things I eat, I need to start like paying attention. Like I just had pizza earlier, and pizza wings and some fries, and my heart was beating so fast and I started having heart palpitations. Like I don't know if it's certain things I'm eating, you know, I don't know. And then it says if you have heart disease, you should see your doctors if you experience heart palpitations, even if they are mild. You know, this is just my life. But there's so many things that you can have about heart palpitations, stress, you know, fear, anxiety, and this, it's a whole bunch, y'all. But yeah, I just wanted to make a little video. And yeah, thank you guys so much for watching this video. Please make sure you like, comment, and subscribe. Turn on the notification bell knowing I post, and share this video with your friends. And I will see you guys in my next video. Bye guys, love you.